system rollout for SHA, for the Social Health Authority that is managing the social health insurance for the country. With us, we have Joy and Mary, who will be taking us through these sessions. And without much ado, I will be handing over. Possibly just two updates for those who are with us today, with us yesterday, sorry. We did indeed give a detailed update of our meeting with the authority. And the only thing that I had promised to bring information on was on capitation. And this I'm hoping to do after tomorrow. We've gotten confirmation we shall be able to do this after tomorrow on capitation. So without much ado, so that we keep it short and concise, Joy and Mary, karibuni sana.
Thank you. Good evening, everyone. My colleague Mary will be taking us through this training session.
Thank you, Joy. Thank you, Dr. Tim. So, hope I'm audible. I'll be taking you through the process, the portal training. So, allow me to share my screen. Okay, yeah, so as I was saying, we have you have the toll-free number, we have the email address where you can raise the different tickets you have in case you have an issue. And also on our left side, we have a link where you can click to learn more about SHA. So I'm going to go ahead and show you how you log in. So we have the login button. So you click on login, then we have the credentials created for the different users for the different facilities. In case you haven't received those, I'm sure they are still being created. You'll have received them maybe in the course of the day. So you input your email address and also the password that you create. In case you need, you have forgotten your password or you need to reset, we have the reset button, or you can click on it, add your email address, then you click send reset link. So it sends a link to this email address, so you're able to go ahead and reset. So on login, this is the landing page. You have the eligibility lookup page. So I'm going to mention something on the top right. You can see hope you can also see my screen, we have the test provider button. So that's why you're able to see you provide your facility name. Then at the top right corner, we have the username and also the logout icon. So to search for your members or to search for the different patients, you use the national ID. So we have this place where you have the icon at the tab for adding the patient's ID number. So I'm going to be using this ID number. So you add the patient's ID number, then you click lookup member. So we have our member here. I'm using this test one user. So it shows you the member name, the member ID number, and also the validity. Then at the end here, we have the action view. Hope you can all see that. So you click on view, then it takes you to the member's biodata. So you can see more details about the member. You have the gender, date of birth, the SHA number, the relationship, and if the member is a principal, then we have the member contribution status and also the different packages. And also on our right side here, it shows you the dependents. If a member has the dependents added in the list, you're able to see the dependents from there. So I can click on one dependent just to show how. So on clicking on the dependent, it shows you the dependent's data or the information, gender, SHA number, date of birth, all that. And also at the bottom, we have the different packages. So I'm going to go ahead and admit this dependent. So to admit, you check for the package that you're attending to. So if you're using something like iHealth, so I'm going to view the sub packages. Then on the sub packages, we have the different interventions on that specific package. So I'm going to go ahead and click view intervention. So for my iHealth package, we have the optical health services. So under that intervention, we have the consultation and prescription and issuing of glasses. So to admit, you just click on admit. Then there's this pop-up where it gives you a breakdown of the member details again. Then we have the different ways of authentication. You can use either the OTP, we have the SHA authorized, and also the biometric, which is still not active at the moment. So to use the OTP, you go ahead and click the OTP. So for this dependent, we don't have the number registered. So allow me to use the principal. Hope you're together at that. So view sub package, view the intervention, then admit, then the OTP. You can also use the SHA authorized, but for the first demo training, I'm going to use the OTP. So once you click on that, we have the phone number which is registered displayed, and also we do hide out some numbers. So you're going to confirm with the patient. You can just ask the patient if the number they're using ends with, let's say for my case, 959, just to confirm. Then you click use to authenticate. Once you've confirmed that that's the phone number that the member is using or the patient, then it's going to send an OTP message to the client. So you will request the client to read you the OTP message or the OTP number sent to their phone number. checking my OTP. So you input the OTP number, then you click verify one-time PIN. Then on verifying one-time PIN, now we have admitted the patient. So going back to, let me just go through it one more time before I take up the questions. So on eligibility, you search using the member national ID number. So I'll be using this ID number. Yeah. Then you click lookup member. So it searches for that ID card or ID number. Then we have our member, it's test one user. We have the ID displayed there. Then it shows you the validity. Then we click on action view. It's taking some seconds, apologies for that. So it's going to show you the member's biodata, as I mentioned, and also the member contribution status. Then at the bottom, we have the different packages and dependents, as I mentioned. So for the dependents, you click on dependents, and at the dependent that you want to view, you click on action view. So allow me to use our principle here. So under the sub packages, if you want to use maybe for a case of hematology and oncology, you go ahead and click the sub packages, then view the intervention. For my case, it's hematology and oncology. So I'm going to click on view interventions. Then allow me to use the PET scan. So you go ahead and click admit. So before I click admit, allow me to mention we have the access point, which for this case of hematology and oncology, we have outpatient and inpatient. And it also shows if a pre-auth is required. We are currently not doing pre-auth, but that will be done soon. So I click admit. So we use the OTP. So for this case, allow me to show you the SHA authorized. So you click on SHA authorized. So for SHA authorized, it will ask you some more questions depending on why you need to use this mode of authentication. So for the location, the first part, which is the location, it picks the location on which your account has been created under. So mine is on main location. Then you have the reason for request. It can either be emergency, it can be maybe there's things to do with card issues or medical conditions. It can be different types of reasons on why you're requesting for that. Then you can add some more notes to the one who is going to authorize. Maybe you can mention, maybe the patient came in unconscious or something. Then on the last part, we have attach a supporting document. So on this part is where you attach a document which will assist the person who's authorizing to identify or confirm that they are authorizing for the correct patient. So you can attach the patient's ID card or birth certificates. Then after you've added all those details, you click on start visit. Then it sends that request to the person authorizing. Hope you together up to that. For the OTP mentioned, and then you confirm the phone number that the patient has. Click use to authenticate. It sends an OTP message to that phone number. You request the member to read you the OTP number. Then you input it on that column. Then you click verify one-time PIN. Then it proceeds and admits the patient. Okay, I'll take up a few questions.
I do not see much of the Q&A, but dear members and attendees who are here with us, please use the Q&A button for your questions. Yeah. So we'll have a minute or so for you to type in and for Mary to take them. I think the first one is out, which use the Q&A, but this one is on the chat. Which claim forms are we attaching from Naisula?
Thank you, Nisula. So at the moment, we're only admitting. I think for the claim forms, someone from SHA will can clarify on that. I think this is the physical claim forms that they do fill at the facility. But on the portal, we're only admitting as at now. But for the other modules, we'll do more training on that.
On the Q&A, are we required to send pre-auth for dialysis? Are we required to send pre-auth for dialysis? The information we got was that any patient who was in the facilities before 1st of October, their process is being handled under HICS for the following steps: member identification and verification and discharge. For managed schemes, it is end-to-end. For managed schemes, and I think there are 96 of them, it is end-to-end on HICS. On the SHA portal, now I think quite a number of modules have been added, and Mary, you will confirm that, or will be added overnight today. And on that, the benefits package is there, and it is authorization that is being sought, not pre-authorization. Authorization is what is being done. When we start from Ahmed, Mary, when we start a visit, it shows that it has an expiry date. Kindly clarify on this. Clarify on the expiry date for the visit.
Yeah, so on the visit, after you admit, sure you can all see it has a period of time before it expires. So that's the okay, that's how long that visit stays open. Understand for different packages, if it's an outpatient, there's the period of time it takes. But not to add more on this, because we're still not submitting the claims on portal apart from admitting. So don't dwell much on the expiry date that is showing on that after you open the visit or after you admit.
The other question is, kindly, if I start a visit and an inpatient, the claim show only 10, only 1,000. Same as all. I have not understood that one very well. Please retype it again, Idris. Can you show us the benefits allocation? Mary, show us the benefits allocation.
Okay, let me go, please.
SHA pay bill, and how do, as Mary is showing us the allocation, pay bill, and how do you do the monthly payments for the clients. I think they had clarified this on their website on how to go about it. Kindly just check on that for the on the website. For employers, we got a communique today, and it says that by 12th, we'll have received how to make the remittances as employers. Mary, back to you.
Okay, thank you, Dr. Tim. So on the benefits, I understand these are the package. Are you talking about the packages? The different packages we have under SHA.
Yeah, I understood it to be the benefits package under SHA.
Okay. Hope you can all see my screen.
Yes.
Okay. So these are the different packages we have. We have like outpatient services, eye health, hematology and oncology, inpatient services, maternity, medical imaging, mental wellness, renal, specialized laboratory. And inside these packages, these sub-packages, we have interventions on each.
Right. I believe that is clear now. I am Edward, who approves the SHA, authorized, and how long does it take, considering that this is usually used under emergency cases. So, like I had said, and then Mary, please confirm this. There's no pre-authorization, but it is now authorization because the benefits are deemed to crystallize the moment someone is registered, and it is an automatic benefit. Mary, I'm right on that one, yeah?
Yes, yeah.
Okay. For clients who we need to give renal and oncology services and claim manually, up to which month should they be paid up? Usually they are paid up a year upfront. So anyone who was paid up a year upfront, the benefit, the monies in form of premium are transferred to SHA. However, when they register, if they're in the informal sector, then means testing needs to be done. And I don't want to believe there will be either a top-up that is due or credit, as the case may be. Good question, but we'll seek more clarity on that as well. We managed to get that far, but how do we put up IC10 and itemized bill on the portal? So far, the portal is only available for dialysis. So far, is the portal available only for dialysis and cancer care? Mary, take that one.
Okay, so the portal is available for all services. The only thing that is pending is the pre-authorizations or the approvals. That's not yet on the portal, but the portal is available for all services.
All right, thank you. Is there official communication to use HICS for managed schemes? Yes, I think it was mentioned yesterday, Liz Motier, in the press statement that was had by providers and SHA. Yes, so for managed schemes, those ones are being used end to end on HICS. There are some that are expiring in October and the rest in November. So we are anticipating possibly 1 quarter use of HICS for managed systems. From Mombati, Mary, how do we bill oncology? How do we bill oncology patients? What price list are we using to determine prices to bill? The last part is easy. We're using the SHA benefits package. On the how, please take that, Mary.
Okay, so for oncology, I had oncology, right?
Correct.
Okay, so for oncology, as I had demonstrated, and the packages we have, like for this case, we have for hematology and oncology. Then on the different interventions, we have the red cell exchange, we have the chemotherapy administration, first line treatment. So we have all these interventions on it, radiotherapy, bone scan, all those.
All right.
Then
So,
you admit.
Okay.
That's clear.
Okay. How do I know that I'm eligible or will get login credentials as a facility? I am a former service provider for NHIF. That is Griffin Odindo.
Okay, thank you, Griffin. So there's a form that was shared. We're adding the facilities or the users were adding their details, the names, the email addresses, the facility details, all those. If you had added your details on that, we are working on creating all the credentials before the end of the day, and we'll have shared the login instructions on the different email addresses. Then in case the credentials you received they're not correct or they're taking you to a wrong site. Also on that sheet, there's a place where you can just indicate that you want it corrected and you indicate the correct information.
Thank you. Maybe you can pick them from the Q&A section as well, so that you will move faster. There is a question from Martin Gakwanyi, sorry. My account after logging in is asking for location and not able to pick location and can't proceed from the initial page.
Okay, I understand we have an issue with the locations. That one is being looked into. I will also reach out to you in case there's an issue on that. But I understand there was some challenges that were being faced on that, but it's being resolved. Trying to trace that question where we are at. So I can see Robert's question, what will happen when there's a system downtime? So in case of a system downtimes, I understand there are always different options on how to tackle that. We have cases of the system. We have cases where we can admit the patients after once the system is back. So there's always an open window of handling that. So a system downtime won't prevent you from serving the patients or your clients. So there's off the system, there's admitting after, and basically, okay, we give a window period where you can open the visits. Then would you mind repeating the IP admission process? I'm going to just go quickly on that. So on eligibility, so I'm just going to go direct to inpatient. You look up the member, then you view, action view, then check for the different packages or the sub packages we have. So inpatient for, let's give it a few seconds. Yeah, so under the different packages, we have the inpatient. You can all see the inpatient services. Hope it's clear for the person who asked the question. You view the sub package. Then these are the different interventions we have under inpatient services. You have the inpatient surgical complications, all those. So under the one that you want, you're serving your client on, you go ahead and click the view intervention. It can be just an inpatient, so you click view intervention. Then we have the management of medical cases. You click admit. So from admit, you authorize either by OTP or SHA authorized. Hope that's clear. How are we supposed to notify dialysis patient who can have? Understand this was answered. How are we supposed to notify dialysis patients who have been dialysis from first till now, but were not since we were advised not to use X? Dr. Tim, you can clarify on this, but I understand those patients who are admitted on HICS before the rollout, the services are being offered on HICS, but anything after that, it's any admission after that is done on the portal. Dr. Tim?
You're done with the questions?
Yeah, there was a question here on how are we supposed to notify dialysis patients who have been on dialysis from first till now?
Notify them.
Yeah, and if I can get this question clear, I think, is this for the clients who are admitted on Hicks before the rollout? I understand that's supposed to be done on Hicks.
Yeah, it was supposed to be done on Hicks before the rollout and discharged on Hicks if it was before fast. Anyone else is just being identified on Hicks and dealt with on the SHA portal.
Okay, thank you. Joseph, hope that's clear.
Yeah. Mm,
I'm just going to take a few more that I haven't mentioned about.
okay.
So, should we still continue to use Hicks for claim submission since the claims module on SHA is not ready? Is there an instance where a client may be eligible on SHA but not eligible on Hicks? Also share the link for tomorrow's meeting. Okay, so for claim submission, it's not being done on Hicks. It's not ready on portal either, but we'll communicate. Okay, yeah,
So
it's being released today, before end of the day. So we'll have it ready on the SHA portal.
uh, indeed, the model is being rolled out today, but the claims that have been, the patients who've been seen between first and now, there's a reference number I believe the system is generating, Mary, and that is what will be attached on the invoicing document, I believe.
Yes. Okay, Dr. Tim, you can take it over from there.
All right. The question on oncology, first part answered, price list not answered. Before we were directed by the approval amount after pre-auth sent. Aha, price list not answered. Before we were directed by the approved amount per pre-authorization sent. So the moment you click on the benefit, the price automatically triggers. So at the moment, there is no pre-authorization that is happening, only authorization. So the moment you tick and it's active, then it is deemed to have gone through. So that's why we are requesting that you keep the documents after you've seen your patient so that that is not lost as we are submitting the claims. The claims for this transition period will be given preferential payment basis so that we do not lose memory of what has been happening by paying them later. Level 3 hospitals, can we continue receiving comprehensive patients like fee for service? Good question. Clarification is one, capitation patients will be seen as per the new SHA capitation rates. That's the first clarification. The second, it will be at level 2 and 3 and select level 4s. Level 2 and 3 and select level 4s and no capitation on level 5 and 6. Meaning, if you're a level 5 or 6, you will refer your patient to the nearest level 2 or 3. Otherwise, it will be an out-of-pocket expenditure for the outpatient. However, say, for example, something like surgery is required, you will see them at that facility, no need to refer. All right. Login credentials. That one I think has been clarified. Do we have members who have paid to SHA? If not, how do we serve this patient? So when the moment a patient comes, you will require them to get into the SHA portal or *147# and register. Means testing will be administered and they'll be assigned a premium upon which they will pay and you proceed with treatment. Ladies who are expectant and showing up for A and C, ensure they've registered so that their maternity benefits can trigger as well. All right. Thank you. So what I have picked are a number of questions that I believe I will request SHA to be on call either today or tomorrow for the rest of the questions. We'll batch them up and that is all they will deal with. Questions that relate to the administration, especially of process and documentation when it comes to claims processing, because I believe that is a very important item. Mary, can you see any other question on your end?
None on my end. There's one on the chat. I think you've gone through, you've answered them. I don't see any additional question on my end.
Thank you. So thank you, dear members, for joining us on the call. We are attempting to do this as frequently as we possibly can. For sure, we understand we haven't answered all the questions. We are taking them and giving them to SHA for clarification, and then providing the same on the WhatsApp group, if you may like. So that's how we are doing it. We are waiting for them to send back the questions, and we are supplying them to you. Asanteni sana. About 45 minutes down the line, we will have this particular webinar on the KHF website. Martin, please provide the link for that so that we are able, members can refer back to it.
Yeah, the link is on the chat.
All right, excellent. A link is on the chat. Please, should you want to refer, it is there. Asanteni sana. Thank you for your time, Mary and Joy. They're part of the team that is implementing the technical bits of the system. Asanteni, and do have yourselves a good evening.